It's just an outstanding endeavor, and probably, you know, the most sophisticated and caring and compassionate project we've ever done. The flow, the feel of it, the bringing the outside in, the healing nature of the environment, the sophistication, you know, of the services that'll be there, the integration of all of those services, the possibility, you know, of a patient to walk in those doors and not feel like, you know, there's onuses on them to figure it all out, just to have that hand-holding and be guided from one area to the other. I think it's just a beautiful concept. It's really going to help patients with that diagnosis. A number of years ago, as we began to look at this program, we noticed that there were a significant number of patients in our community who sought advanced cancer treatment outside our service area in other facilities. And we felt very strongly that a cancer diagnosis is very draining on the patient physically and emotionally, and we felt that advanced cancer care should be here in Lebanon. It should be close to home, and every patient in this community should have access to the best cancer care possible.
I think that the fact that there's so many things available to the patient in one location that makes it easy to obtain. When you have cancer, fatigue is a part of it, and the running around is draining, and the labs, the radiation, the chemo, meeting our financial consultant, seeing other physicians here, meeting our nutritionist, all in one location for one stop. And I think that's what makes it unique. The other thing that's very special about this place is the involvement in the community from the start, starting with Mr. Sechler's wonderful donation, but other people that have donated things that they really wanted to specify what they wanted, like our spiritual center. That's a wonderful place that is an absolute necessity in a cancer center. And it was really neat to walk around and see what everybody put into it. The Ani family wanting the entranceway to memorialize their son, and it's so beautiful. And I think it really filled their need to memorialize him. So there's little pieces of it that were put in by the community.
When we announced the plans for the Cancer Center and the need and what we were going to do to respond to the need in this community, as always, our community came through in many ways, and you just walk around the building and you can see examples of the donors who have given significant amounts of money to help us to make this reality. We established a capital campaign with a goal of helping to retire the debt of this project, and we were fortunate to have a boost from Scott Sechler and Bell and Evans, who had already begun their own fundraising effort and agreed to support cancer care in our community.
We looked to talk with and we interviewed all the healthcare providers that would play a role in the oncology patients' trajectory of their disease. We also talked to community leaders, we talked to senior leaders at the hospital, we talked to different disciplines, support services, we actually talked to patients, board members of the hospital, and we were getting all of everybody's input as to what they would look for in a cancer center here in Lebanon County. This is an amazing addition for the Lebanon community. The WellSpan Good Samaritan Hospital and the Sechler Family Cancer Center is bringing the first integrated cancer care here. It keeps our patients close to home. Our patients are able to come into the center, have a blood test done, see a physician, receive their chemotherapy, receive radiation therapy, see all of their support services, and get the help that they need all under one roof. They're able to come here, not have to leave the county to receive quality cancer care.
When our patients see the new center, I think they are going to be astounded by everything. We've gone all out to make the patient comfortable. Our infusion bays are very peaceful, relaxing. We've tried to think of every comfort for the patient. We have beautiful new chairs that fully recline. They have heat and massage. They have a private area, but they also get to look out on the water feature, which is very beautiful. I think we went above and beyond what we needed to do to make the patient comfortable. It's so soothing and relaxing, and we tried to think of everything so that the patient would be the most comfortable.
We have an outstanding group of clinicians and support staff, but now with the addition of radiation oncology and the opening of this beautiful cancer center with its healing environment, we are truly able to provide integrated cancer care to the community of Lebanon close to home. This was our vision, and now it's our reality.